Hi everyone, this is me, Danny. I came back from Santa Cruz last week, had a blast. It's been a week since I've done a video, so I'm gonna follow the theme going on with nursing. So, today's video I want to talk about is how to do well during interviews when you're applying for your first nursing job. Now, the first thing I say you should do, which I did myself, was do a nursing portfolio. So basically, a nursing portfolio is just a binder, have some tabs in there, and put in all your paperwork, all your certificates, resume, cover letter, letters of recommendation, people that can be your contacts, that your interviewer can contact them if they're going to get more information about you as an individual. So for mine, I basically had my resume, I had my cover letter, I had a personal statement on there as well. Also, I had my certificates, so I had my BLS, I had ACLS, my PALS, I had those three, and the stroke skill test as well. I had that certificate on top of that. I put in some awards that I got in, like a scholarship from the hospital themselves that they gave me a scholarship, helping me to pay for my schooling while in nursing school. So I added that in there. I also put in my bachelor's of nursing degree in there, and as well as my license. So just to show like all the proof that I have, like yes, I have the qualifications. I am qualified to be part of your team. I have all my paperwork here and all my ducks lined in a row. And it's a good impression because it shows that you're organized, you have everything together. It shows that you're on top of things and that you're serious about wanting to get the position. So I felt like the person that interviewed me was actually impressed that I had a nursing portfolio and had everything nicely organized as well. So that's one big tip I would give. Definitely make a nursing portfolio and add any kind of paperwork that you think is essential and makes you stand out as an individual. So definitely include all that paperwork. Any little thing helps in case you want to show it to them or even ask for it. You never know. So definitely nursing portfolio, go with that. And then some tips about like during the interview process. I say when you go do your interview, don't go with a lot of makeup. Don't wear like big hoop earrings, very extensive makeup, um, fake nails. Don't dress all flashy. Don't wear like a tank top or a regular shirt and blue jeans and boots and whatnot. Dress business casual attire. Probably like a little light of makeup would be fine. Make your hair look nice. Make sure you don't got no wrinkles on your pants or on your shirt because you're trying to make your first impression, and first impressions are everything in whatever you do at any kind of interview. So the moment you come through that door and they see you, they're probably already making judgments, trying to figure out, okay, what kind of person this individual is. So I mean, they say don't judge a book by their cover, but judgments can be made, and if they don't like how you're dressed, they could just say no, and you will never know why the reason it is. But I know some places they do that. So I went in with regular dress pants and a plain white shirt with some dress shoes, and I had my hair up in a bun, so I was very plain. I didn't want to risk anything, so I just went plain Jane on that part. On to the next thing is that for questions. So some questions that they might ask you during the interview is the main one you should know is like, why did you become a nurse? What is the reason why you came into the nursing profession in the healthcare field? So definitely make sure you have your story. Don't make it too extensive, but make it short and sweet, and give the major hit points of why you want to become a nurse. So that's definitely one that they'll always ask. Another thing is know the process of ADPI. So you're doing the assessment, diagnosing, interventions, and the whole nursing. Just remember doing the whole nursing process and remember in order. So ADPI, definitely go with that because it might give you a scenario saying, you have this patient. What would you do for this patient? And they give you the scenario, so you have to use ADPI in order to figure out, okay, this is what I will do for this patient. Also, be well educated on what area you're applying for. So if you're doing surgical, then do know some background regarding like surgeries and whatnot. If you're in ICU, learn about what to do in the ICU or ER or peds or labor and delivery and whatnot. So if you're interested in that area, then have a general background about what possibly goes on their floors and what is their main focus with their patients on their units. how they're taking care of them on there. So that shows that you've done your research, you've done your homework, and understand, okay, these are the type of patients that I'll have on the floor. This is what I kind of care I'm gonna have to provide. Because usually you see the same cases going in and out on the units themselves. I personally work on a surgical floor, so I see a lot of the same surgeries. I see INDs of the foot. I see lap choles, lap appies. I see hip replacements, joint replacements of that kind of deal. So I had already a general idea what was going on in the unit because I did my senior focus there during nursing school. So I already knew that it was like what kind of surgeries already occurred, and I told my interview individual, which was the manager on the unit, about the kind of procedures that go on in there. So she was impressed that I knew my stuff that way. And I had a very good preceptor. He taught me very well. So I have to thank him a lot. His name is Randy. Great nurse. I love him to death. He's an awesome preceptor, and he taught me well, and he really helped me out a lot during nursing school, and he's helping me out a lot now too, as being a new grad at the hospital that I'm working at. So shout out to you, Randy. Thanks. The next thing I would also say, another question would be like what's your priority regarding if you had a certain amount of patients, who would you see first? Who's your most priority? Remember your ABGs. That's always like number one: airway, breathing, and circulation. So keep that in mind. So know how to prioritize. I think another question would be I can't really remember much what they asked me. I guess it's like also like ethics or ideas, like what would you do in certain ethical situations. Um, what would happen if you had a coworker that was, you saw them that they were kind of out of it, or they smelled like alcohol. What would you do to approach them to resolve that kind of situation? So sometimes your interviewers, they want to see like how do you think, what would you do, and if it's wrong, then it's okay. They'll tell you, well, in our policy, it's this is what you have to do. This is our process that you would do. I remember my interviewer. She asked me if I had my computer and I had a patient and I had a question regarding that patient. Would it be okay if I showed my screen with that patient information to another nurse? And I was thinking about it, and I said no. I don't think that would be appropriate. But she told me, actually you can, because it's from health profession to another health profession, so they can actually look at it and verify with you to make sure things are okay. As long as they're not like constantly in the chart, then it's okay. Then it's not like violation of HIPAA. So that I didn't know. I'm like very what's the word? I'm very cautious. I'm very protective of information of my patients. I would take HIPAA very seriously. So I wasn't aware that I can get help like that. So it was nice to know I can ease up a little bit, but still I'm very cautious when it comes to HIPAA, because it's everything. To me, patient information, you gotta protect it. And it's very important, because like I wouldn't want no one knowing my personal information to other people, because that's my privacy, that's my information, and I'm trusting you not to share it with other people. So I totally get that part on that. But yeah, and also during your interview, don't be nervous. Just relax, take a deep breath before you go in. Say a little prayer if you need to. I know I did a lot of praying the night before and then the morning of my interview. But also end your interview in a way asking the person, like your interviewer, like if they say, "Do you have any questions?" and then one of them could be like, "Oh, when would I expect to hear back from you?" That's an appropriate question you can ask. Another question you can ask them to make it a little bit more light of the conversation is ask them, why did they become a nurse? And I think that sometimes people can feel, it feels kind of nice to be asked, like, why are you a nurse as well? And I know my interview, I asked my person, and she told me why she became a nurse. It is very nice. It made the light of the situation. I felt less stressed. I got to know her. She was super nice throughout the whole interview. So I really liked it. I really liked her a lot, and I was hoping so hard that I could get on the unit. So yeah. Hi, Dad. Yeah. I was making